Do you eat heavy meals at night because you believe going to bed full gives you better rest? Do you think loud snoring is just something normal that comes with age? And have you ever heard that taking blood pressure medication before sleep is more effective? Well, these behaviors, which seem harmless or even recommended, may silently be increasing your risk of a stroke, heart attack, or even cognitive decline, such as Alzheimer's. Current science is clear. Small nighttime habits, from what you eat to how you get out of bed, can be true triggers for heart and brain diseases. And the most alarming part? Almost no one talks about it. But in this video, you'll understand what's behind these 7 dangerous nighttime habits and how each one directly affects your health, even if you feel fine today. Stay with me until the end, because habit number 1 will surprise you. It involves a medical practice that was widely recommended for years, but that recent studies have completely debunked. Understanding this could truly save your life. Now tell me in the comments, what nighttime habit can you not give up? And where in the world are you watching from? Let's map out this community that wants to age with health. Let's begin. Habit number 7. Drinking too much water before bed. You've heard it your whole life. Stay hydrated, and it's true. But there's an important detail that few people talk about: the timing of your water intake. Drinking large amounts of fluids at night leads to a condition called nocturia, the urgent need to wake up and urinate in the middle of the night. The problem? It's not just about interrupted sleep. Getting up in the dark, groggy, and in a hurry increases the risk of falls. And a fall at night, especially for people over 60, can mean a hip fracture, loss of independence, or even fatal complications. But it doesn't stop there. Studies show that waking up more than once per night to urinate triples the risk of cardiovascular death. Why? Because fragmented sleep disrupts the body's repair processes, raises blood pressure, deregulates metabolism, and is linked to type 2 diabetes. Plus, nocturia can be a symptom of serious underlying conditions such as heart failure or sleep apnea, both of which also raise stroke risk. The solution? Hydrate during the day. In the 2 to 3 hours before bed, reduce fluid intake significantly. If you feel thirsty during this window, a small sip is enough. Also, avoid diuretics at night, such as coffee, green tea, or other stimulating drinks. Habit number 6. Eating a heavy dinner. For many people, dinner feels like a well-earned reward, but your body doesn't see it that way. Eating large, fatty, or high-calorie meals late at night forces your digestive system to work overtime when it should be winding down. The immediate result? Heartburn, reflux, poor sleep. The long-term result? Far worse. Studies from the Federal University of Uberlândia in Brazil found that late, heavy dinners increase visceral fat, the type of fat that surrounds your organs and is directly linked to heart attacks. In addition, eating late prevents your blood pressure from dropping naturally during sleep, a phenomenon known as dipping. Without this drop, your blood pressure stays elevated overnight, straining your arteries and increasing cardiovascular risk. What should you do? Follow a simple rule. Finish your last main meal at least 3 hours before bed. Choose light, whole, unprocessed foods for dinner. Avoid treating yourself with fast food or leftovers from lunch. Let your body wind down properly. Habit number 5. Sleeping in a position that prevents your brain from cleaning itself. Few people know this, but the brain also needs a cleanup. Every night during deep sleep, a system called the glymphatic system goes to work. Its job? Flush out toxic proteins like beta amyloid, the one associated with Alzheimer's, and other harmful substances that, if left behind, can lead to neurodegenerative diseases. And here's the key. This brain cleaning works best when you sleep on your side. Sleeping on your back can worsen snoring and increase the risk of sleep apnea. Sleeping on your stomach strains your spine and causes pain, but lying on your side with proper spinal alignment, supports circulation, and allows the lymphatic system to function optimally. Want to improve even more? Place a pillow between your knees. It helps align your pelvis and lower back, reduces pressure points, and encourages deeper, restorative sleep. Habit number 4, sleeping in a room that's too warm. You've probably noticed how hard it is to fall asleep on a hot night. That's not just discomfort, it's physiology. To fall into deep sleep, your body needs to lower its internal temperature. A warm room makes that process difficult. The result? Lighter sleep, frequent waking, and no real rest. But the danger goes further. Hot environments cause mild dehydration, often unnoticed, which makes your blood thicker and more concentrated. In simple terms, your blood becomes more viscous. That's a major problem for your heart. Think of it this way. Well-hydrated blood flows like olive oil. Thick blood flows like syrup. That thicker blood forces your heart to work harder and raises the risk of clots, the kind that cause strokes and heart attacks. What's the ideal solution? Keep your room temperature between 64 degrees Celsius and 70 degrees Celsius, 18 to 21 degrees Celsius. Use a fan or air conditioning if needed. And keep a small glass of water nearby in case you wake up thirsty, but don't overdo it. Habit number 3, jumping out of bed right after waking. The alarm goes off. You open your eyes and jump out of bed. Seems harmless, but this sudden movement can cause a serious shock to your system. When you get up quickly, after lying down for hours, gravity pulls blood into your legs, temporarily reducing the flow to your brain. For people over 50, or those with high blood pressure, diabetes, or heart issues, this can lead to a dangerous drop in blood pressure known as orthostatic hypertension. The symptoms? Dizziness, blurred vision, feeling faint. Why does this matter? Because early morning hours are the most vulnerable time for cardiovascular events. Studies show that most strokes and heart attacks happen between 6 a.m. and 11 a.m., and this abrupt transition from lying to standing can trigger a crisis. How to prevent it? Use the 30-second safety ritual. When you wake up, sit on the edge of the bed for 10 seconds, breathe deeply. Then, place your feet on the floor and stay seated for another 10 seconds. Feel stable. Finally, stand up slowly and remain still for 10 more seconds before taking your first step. Just 30 seconds. That's all it takes. But this simple ritual could be the difference between a peaceful morning and a trip to the ER. Habit number 2, ignoring snoring, your body's cry for help. If you've been told you snore loudly, or if you've ever woken up gasping during the night, know this. It's not just annoying, it's a red flag. Loud snoring, especially with pauses in breathing, is one of the main signs of obstructive sleep apnea. During an apnea episode, airflow stops, blood oxygen levels plummet. To survive, your brain sends a surge of adrenaline and cortisol, forcing you to gasp and start breathing again. Now imagine that happening dozens or hundreds of times each night, every night. Your body enters a state of constant stress, with repeated spikes in blood pressure and heart rate. This increases the risk of arrhythmias like atrial fibrillation, which can lead to stroke, and significantly raises the chances of heart attack. And the worst part? Many people think it's just part of getting older. It's not. Sleep apnea is one of the most common hidden causes of drug-resistant high blood pressure, and it's directly linked to type 2 diabetes, cognitive decline, and even sudden death during sleep. Watch out for these signs: loud, regular snoring, pauses in breathing noticed by a partner, gasping or choking during the night, feeling tired despite 7 or 8 hours in bed, morning headaches, irritability, or difficulty concentrating. The solution? See a doctor. If there's suspicion of apnea, the gold standard is a polysomnography or sleep study. And if the diagnosis is confirmed, starting treatment can be life-changing. Treating sleep apnea is one of the most powerful and effective actions you can take to protect your heart and brain. Habit number 1. changing your blood pressure medication schedule on your own. This is the most delicate topic of all. For years, a medical recommendation spread widely. Take your blood pressure meds at night. It protects your heart better. That advice came from a Spanish study called HYGEA, which claimed that nighttime dosing reduced heart attack risk. But science evolves. It questions itself, and it corrects. Two much larger and more rigorous studies, Time 2022 and BedMed-Frail 2024, published new findings. There was no benefit to taking blood pressure medication at night compared to morning. Worse, in some patients, taking the medication at night caused excessive drops in blood pressure during sleep, increasing the risk of ischemic stroke and dangerous falls upon waking. The real problem is following generalized advice or changing your medication time on your own without medical supervision. The golden rule, backed by current science, is consistency is more important than timing. Take your medications at the same time every day, preferably when you're least likely to forget. And always make that decision together with your doctor. Avoid dogmas, avoid medical fads, and never forget what works best is what's right for you. Conclusion. Your nighttime action plan starts now. Night doesn't have to be a danger zone. It can and should be the most powerful moment of the day to protect your health. Sleeping well in the right environment with proper habits strengthens your heart, brain, immune system, and even your mood. Review your nighttime routines today. Start with small changes. Improve your dinner schedule. Reduce evening fluids. Adjust your room temperature. Choose the right sleeping position. And most importantly, listen to your body's signals. Now tell me, which of these habits will you change tonight? Leave a comment below. Let's learn together. And if this content helped you, give it a like, subscribe to the channel, turn on notifications, and share this video with someone you love. Remember, health is not just about big decisions. It's built every day and every night.